Yeah, maybe thanks, Ayanda, for having me. Let's actually maybe put this matter in perspective, whether reputational challenge was manufactured or real. And I think that I'll leave to the media to assess. Suffice to say, Tembisa Hospital, like any other health facility within the country, is faced with this monster of COVID-19. And we have prepared within the ambit of our capability to be able to circumvent the swimming of numbers within the hospital. And I have to state for a fact that we are actually humbled by the compliance that we have seen recently in this second wave by the community of Tembisa with regard to their wearing of masks and actually keeping all the guidelines in possible. That's why up to this stage, despite the high numbers we have at the hospital, we have not actually been overwhelmed to have patients eventually sleeping on the floor.
When you sort of bring up the question about whether the reputational questions are manufactured or real, what do you mean by that? I mean, I presume this is in relation to the scandal that surfaced, I think it was late last year, when Shonisani Letole tweeted that essentially he's been forced to starve while dealing with COVID-19 at that institution. My understanding is that it later emerged he was lying.
In my upbringing, I've actually been taught to be respectful to the departed. And I would not emphatically say anything that seeks to degrade their memory or their name. Suffice to say, some of the challenges that have been prevalent in Tembisa Hospital were not mutually exclusive to Tembisa Hospital alone. There were challenges that were prevalent within all other health facilities within the healthcare space. But amazingly and surprisingly, it was actually surprising that it was only Tembisa Hospital that was put on the map to actually reflect on those challenges. But being committed citizens, being committed workers, we always welcome that interrogative eye as it prepared us to be very strong and resilient to ensure that we mete out the best healthcare service possible to our people. And we welcomed every scrutiny that we received and will continue to actually welcome it.
It's a good point. I'd actually just missed that he had sadly passed on. Apologies for that. We are hearing, though, of a general shortage of things like oxygen tanks. Give us an idea of how the situation is looking like at Tembisa at the moment.
You know, we need to reflect from the lessons learned from the first wave. As Tembisa Hospital, when we prepared 2 tanks, we put actually up another 2. When we prepared for the first wave, we put 2 more tanks, which were for 20,000 liters of oxygen each. That has kind of absorbed us from being able to completely experience challenges of oxygen. But we had challenges with oxygen to theater during December holidays. And the challenge that has been experienced was purely because of there were no regulators and our regulators needed service. And when the Department of Infrastructure Development searched all over, we found that most companies that supplied those regulators were closed. I'm actually pleased to inform you that by today, we'll actually have 2 regulators installed, and I think it will go a long way towards assisting us, particularly in theater. But one thing which I want to emphasize on oxygen, when you have got more and more people on oxygen, the pressure levels tend to go high. I think at the hospital, we are sitting now at 350 kVA, where the necessary one which doctors need is around 400. And that's something that we are working along with the Department of Infrastructure Development as well as AFROX to ensure that adequate supply of pressure supply of oxygen is actually available in the hospital.
Yeah, when you say there's 350 kVA, what do you mean by that? It almost sounds like a technical term that might not necessarily make sense to our viewers. Can you give us a bit more perspective by what kVA is?
kVA is a kilo voltage. It's a pressure level, pressure through which oxygen travels through the pipes to the desired destination. As we actually pressure, how it actually moves out there, it must be sufficient enough to be able to do the desired output, and
Right.
there's a certain pressure level that is necessary.
I see. Okay. The other concern that's plagued Tembisa Hospital in particular was issues around Klebsiella, right? Remember late last year,
Yeah.
several babies sadly passed on. How has that complicated your ability to respond to another highly infectious disease within the same institution potentially?
Yeah, I have to state this for the record that Tembisa Hospital delivers the second highest number of babies in the country after Chris Anibara. And it is actually not impossible or an anomaly to find that at any point in time we've got 90 neonates or what we can call premature babies within the hospital in a 40-bedded ward. But the meticulous nature through which our nurses and doctors work has resulted in the reduction, or if it can never be completely destroyed, Klebsiella, because it can colonize or be infective. We have actually completely removed that anomaly in terms of the Klebsiella outbreak, to such an extent that with regard to the compliance matters, from the National Department of Health, I can safely and happily say the Department of Pediatrics in Tembisa Hospital has got all the positives, the green bar codes in order in as far as the assessment is concerned. I want to say to you, the challenge we are having now is the challenge which is the whole country is facing, which is the challenge of actually the coronavirus pandemic. God has been merciful on us with regard to the Klebsiella and all other measures. Our people have learned from their past experiences.
Right. I wonder whether you too are seeing a decline in people coming for treatments of other ailments. We know, again, Tembisa, embedded in a community, typically people would obviously need to keep track of any other diseases that they're battling. Are you also seeing a decline in the amount of people at least coming in for regular checkups even to try to keep these other illnesses at bay?
Well, unfortunately, with regard to the medical wards, we are not experiencing any decline in terms of the numbers. But we have canceled some elective cases like your surgical electives and certain other electives in other disciplines. That is actually major cases. So we are seeing decline in that. But in terms of the medical area, we are still seeing a lot of patients in our outpatients department. We do everything materially possible to ensure that social distancing is practiced. We ensure that sanitizing booths are available and everything. So there's not been actually a decline, because Tembisa Hospital is the only option to the citizens of Tembisa community.
Right. And I wonder whether you're also noting what we are learning to be the situation in other provinces like Limpopo, where there's now a real dire shortage of medical healthcare workers, because sadly some of them, are also contracting the virus. How dire is this issue at your institution?
Well, we have been, should I say we have been blessed or we have been lucky? To date, since the first wave, our total number of staff members that were infected are standing at 22. And we unfortunately lost 4 of those since the first wave. This year, we have not actually lost anyone. So the meticulous nature through which all the committees that we formed within the hospital engage and with the staff and to ensure that compliance is realized have resulted in us seeing less number of staff being infected. And surprisingly, some of our staff members that are infected are even not on the clinical side. People who are on the bedside in those COVID wards are the ones which are always left standing to ensure that service to the patient is actually never compromised.
All right. Thanks very much for your time. I mean, this is just perspective from one institution, and it's always important that we hone in to really get a sense of the situation on the ground.